Okay. So let's look at the face. So from the hands, you go to the face. Obviously, you also take blood pressure. Okay, you can take blood pressure as well, because remember, like in the case of pneumonia, you find that blood pressure can be reduced. So please, on the hands as well, make sure that you take blood pressure. Okay, so let's look at the face. So this video, we're going to talk about the face and the neck. Okay. So you go to the face, then the neck, then you come to the chest, then you go down to the up to the legs. Okay. So what do you look at on the face? Number one, in the eyes, you look at conjunctiva pallor. Okay, so obviously this is also in the case of anemia for whatever reasons. Okay, it can also pallor also even like if you're checking on the hands, it can also be present like in cases of albinism. Okay, so but the commonest is anemia. Then you can also look at in the mouth, for example, you can look at central cyanosis. Okay, even in the conjunctiva, we can see cyanosis, or on the tongue, you can see central cyanosis. Okay, so you find that the tongue is looking bluish, right? You can also look at what is called angular stomatitis, although this is more common in GIT, angular stomatitis. Okay. Can also find others. Okay, so basically those are some of the things that you can look at on the face. I mean, in the mouth, on the face, and okay. So you have. By the way, you can also see what is called ptosis. Okay, ptosis. Like in the case of Horner syndrome. Okay. Remember what is the tumor, what is called pancreas tumor, right? Of the apex, just the apex of the lung. You can find what is called ptosis, okay? So all those are some of the things that you can look at. Okay, ptosis, meiosis, anhidrosis, okay, on one side, okay, which is, and then you can also have conjunctiva pallor, like I've mentioned. Okay, and in cases, especially children, okay, especially children, you can have what is called nasoflaring. Nasoflaring, okay. Nasoflaring is this is found in respiratory distress. Okay, in respiratory distress, what is going to happen is that the patient is more like laboring to breathe. So you'll finding that the purpose of the nose, they are more like they start nasoflaring. Okay, so they are rising and going down, rising and going down more than normal. Okay, so that is what is called nasoflaring. Okay, those are some of the things that you can see on the face. Obviously, other than that, you can look for things like scars. You can look for things like tattoos and so on and so forth. All right. Now on the neck, basically here you want to look at cervical lymph nodes. Okay, cervical lymph nodes. Okay, so cervical lymph nodes very important. Okay, these lymphadenopathy can be found in things like TB. Okay, can also be found in things like lung cancer. Okay, lung cancer and TB can give you cervical lymphadenopathy. Then, other than that, you also look at JVP. Okay, JVP, that is jugular venous pressure. Now, you tell the patient to look the other side. You're going to see that it's going to be between the two heads of the sternocleidomastoid muscle. You're going to see a bulging vein there which is called, which is the external jugular vein. So that is what is called JVP. Now, JVP is in the case of respiratory system, it's increased in a case of what is called copulmonale. Copulmonale is where there is lung disease, and then that lung disease causes what? Causes right heart failure. Okay, so because of right heart failure, you find that there is a backflow of blood from the right ventricle, and then goes back into the what? Into the circulation system. Okay, and then you find that the jugular vein is being what? Is bulging. Okay, or there's increased pressure in the jugular vein. Okay, so that is in the case of respiratory system. So JVP is increased in the case of copulmonale. Okay, and also in the case of pulmonary embolism as well as COPD. But obviously, all these COPD is going to lead to the same copulmonale. Okay, then other than that, you also look at position of the trachea, the centrality of the trachea. Okay, position of the trachea. Okay, position of the trachea and what is called stenocricoid distance. Now, specifically on position of the trachea, you want to know, is the trachea central or not? Now, what you do, obviously, you have to warn the patient that it is going to be uncomfortable. So usually we use the middle finger, and then you place these two fingers on the two heads of the clavicles, the middle heads of the clavicles, and then you palpate for the trachea, and is it central? Okay, if it's centrally located, then yeah, okay. But if it is deviated either to the right or to the left, then you want to think there is probably some pathology. Okay, so is the trachea central? So you do like that. So you want to check for centrality of the trachea. It feels quite uncomfortable, and you have to tell your patient that it's going to feel quite uncomfortable. All right. Now, when you look at hello. Okay. So what I was saying is you look for the centrality of the trachea. All right. Now, things that can cause deviation of the trachea to one side, all right, can be looked at as those that can cause ipsilateral deviation of the trachea or contralateral deviation of the trachea. That is, if the pathology is on the right side, then the trachea also deviates to the right. Or if the trachea is on the left side, if the pathology is on the left side, the trachea also deviates to the what? To the left. Okay. For example, in the case of fibrosis, if there is fibrosis, then we expect that the trachea may be pulled to the what? To that side where there is fibrosis. Okay. So the side where there is fibrosis, that's where the trachea is going to be pulled, and hence you're going to see that deviation of the trachea. You can confirm that. You can see that even on chest X-ray. If you take chest X-ray of the patient, you're going to see that the trachea is deviated to one side of the chest. Okay. Also, in the case of lung collapse, for example, okay, if the lung has collapsed on the left side, then we expect that it's going to be deviated on, because it means that on the left side there's going to be more space. Hence, the other side is going to be a bit more inflated. The other lung is going to be a bit more inflated. Hence, push the trachea to the other side where the lung has collapsed, isn't it? So that's what what is going to happen. Okay. Then contralateral deviation of the trachea. What you can see are things such as tumor, okay, or things such as pneumothorax, where there's a lot of air, hydrothorax, where there's a lot of fluid, okay, or hemothorax, there's a lot of blood. So that part on that side where there's that pathology, there is little space, and that pathology is pushing the trachea to the other side of the chest. Okay, so that's how you look at tracheal deviation. Either it's lateral deviation or contralateral deviation of the trachea. Okay, I hope we are following, and I may probably be leaving out one or two things, but I think a good number of things we are trying to include them in our discussion. Okay, so that is about the face and the neck. I don't know if there's anything that I've probably left out before we can. Now, I've also talked about I've talked about the stenocricoid or cricosteno distance. Now, the normal distance that is supposed to fit only 3 fingers, which is about 3 centimeters, 3 fingers like that. So if you palpate somewhere here, you're going to feel the cricoid, cartilage, right? So you find that normally it's supposed to be less than 3 centimeters. Now, if it is less, I mean, if it's supposed to be somewhere around 3 centimeters, if it is less than 3 centimeters, then you are having what is called, we can have, let's say, hyperinflation. Hyperinflation, okay? So that it means that the lungs are hyperinflated, and then it means that the whole thing is going up, the distance is going a bit up, and so on, all right? So those are some of the things that we look at under the face and the neck, okay? If there's any question, please feel free to ask. So we've looked at so far we've looked at general inspection, and then we've looked at the hands, then we looked at the face and the neck, and then we want to go to the chest. Okay, so I'm going to end this video right here before it becomes too long, and then we can proceed to the chest.